Last week, I asked people in my newsletter to share with me any of their experiences with the Affordable Care Act. The response was overwhelming, and the majority was positive. Danny Blight lives in Germantown, Illinois. He was diagnosed with bladder cancer in 2005. At the time, he was lucky enough to have a job with health insurance. Then he was fired and let go. He lost his health insurance, and he couldn't afford coverage because of his pre-existing condition, a history of cancer. And he required surgery to treat his cancer. According to Danny, he relied on the local Sisters of St. Francis to provide basic care for him and his family when he couldn't afford health insurance, until the Affordable Care Act became the law. Now, Danny Blight and his family have health insurance. Is this an important law for them? Maybe the most important thing we've done here when it comes to this family. I got in a debate back in my hometown once with a group that opposes this law, and they were the opposite political faith, and I knew it. And they had some pretty strong feelings about the role and size of government, and they said as much. And I would tell them, I'd answer them by saying, well, let me tell you about a family that I met. Let me tell you about this family. And finally, one of them stood up and raised his hand and said, stop telling stories. We don't want to hear these stories. I know why they didn't want to hear them. Because these stories are reality. These stories don't reflect political philosophy so much as the reality of life for a lot of people across America. We know that discriminating against families because of pre-existing conditions is a real problem. We know there are many families, for example, with a history of some illness, even mental illness, who in days gone by had no chance to have health insurance. There were two other things we did in this law, and I don't understand why the other party wants to get rid of these provisions. The Affordable Care Act says if you have a child graduating from college, your family health insurance plan can cover them until they reach the age of 26. Why is that important? Because many times young people coming fresh out of college have a lot of student debt and no job, no full-time job, and very few of them have health insurance immediately. And they think they're invincible. I remember reaching out to my daughter when she graduated from college. Jen, I said, what about health insurance? Dad, don't worry about it. I feel fine. Well, I did worry about it. And a lot of parents do. So our law says you can keep your recent college graduate under your family plan until they reach the age of 26. Why would you want to get rid of that? Why would someone want to eliminate that provision in the law? The other thing it said was if you are a senior and you are under Medicare, the Part D that provides your prescription drugs used to have what's called a donut hole in it. And what it meant was Medicare would cover your prescription drugs to a certain point and then stop, and then you had to go to your savings account, pull out about $1,200, pay for your prescription drugs, then coverage would start again. The donut hole, we called it. We filled it. We filled it so seniors don't have to worry about going to their savings to make sure that they can keep taking prescriptions that keep them independent, strong, and healthy. What's wrong with that idea? Why do they want to get rid of that? That is part of the Affordable Care Act as well. I just wonder sometimes if those who get all tied up over the philosophy of this legislation deal with the reality of family life in America. Jean Terrian and her husband Michael live in Evanston, Illinois. They're both cancer survivors. Jean had breast cancer at age 45, Michael prostate cancer at the same age. Neither could purchase insurance before the Affordable Care Act because of the pre-existing medical conditions in their family. Because of this law, they have an affordable policy, and Jean is able to do freelance work without having to worry about health insurance. She told me she worries about losing her coverage if the Supreme Court goes the wrong way, or if the majority party here gets their wish and abolishes the Affordable Care Act. I think we owe it to them to strengthen the law and not to repeal it.